Hi, I'm Dr. Erin Frank, and I'm the Assistant Clerkship Director for the medical students here at Rainbow. Today, I wanted to give a quick introduction to your outpatient portion of the pediatric rotation so you guys know what to expect when you're starting in our clinics. Basically, the schedule for the outpatient rotation, you have 6 weeks total on pediatrics, and that's divided 3 weeks inpatient and 3 weeks in an outpatient experience. Of those 3 weeks in outpatient, we're going to spend 2 of those weeks specifically in an outpatient clinic. The locations vary, so there are some private practices, some group practices, and some of you may even rotate here on main campus in our pediatric resident clinic. The remaining 1 week of your outpatient rotation is going to be spent in the newborn nursery. This is a chance to get a lot of interaction with newborns, a lot of interactions with families. The basic schedule for your newborn nursery week is basically rounding Monday through Friday. You'll start your day with morning rounds, and in the afternoon, you'll have a chance to do follow-up on patients, attend deliveries, and provide direct patient care with both the infants and families. On the first day of your newborn nursery rotation, meet the resident team in the McDonald 3 nursery, which is located right in the center of McDonald 3. During this week of your rotation, please go ahead and wear scrubs. Deliveries aren't always the cleanest, and you don't want to ruin your clothes. If anyone needs help in obtaining scrubs, you can contact Kelly, and she can provide you with a memo. Newborn nursery is a great chance to work on practicing your physical exam skills. It's a very busy location. We have a lot of newborn babies that come through, and oftentimes there's a good chance you're going to get to see some abnormal and normal newborn physical exam findings. It's also a great chance to have lots of one-on-one interaction with families. All of these families receive anticipatory guidance from our resident team prior to homegoing. And as you follow the babies throughout the week, you'll get a chance to build that relationship with the family and begin working on your anticipatory guidance skills. During the other 2 weeks in the outpatient clinic, your schedule is going to be a little bit varied. You'll work in the outpatient practice Monday through Thursday. Basically, you'll follow the hours of the clinic that you're working with. Tuesdays and Thursdays, as you guys know, there are didactic lectures back here at main campus starting at 4 o'clock, so please leave some travel time. Many of these outpatient practices that have agreed to take you in the clinics are a driving distance away from main campus, so you want to make sure that you leave transport time to always be on time. Make sure that you contact the practice that you're going to be starting with before the first day of the rotation. Most practices' hours are going to range between 8:30 and 9 a.m. until about 5 o'clock, but again, you'll want the specifics for that practice. Which practice location you're going to be working with is located on the website, and this can also be obtained from Kelly prior to starting the rotation. As I mentioned before, we use a variety of settings for our clinic. So some of the practices you'll be working with one individual practitioner throughout the entire 2 weeks. Many of the practices are group settings, so you may rotate with several different preceptors during the time that you're there, but you should receive your schedule specific to that practice on the first day of the rotation. Expect that during outpatient, you're going to see a mix of well child care and sick visits. We really would like you to focus on seeing a good number of well child visits across the entire age range. One of the things that's really unique to pediatrics is the fact that we see patients from birth up through college-age students. So there's a huge variation in the care that we provide to patients based on their age. This will be a chance for you to see patients independently and staff them with your preceptor. It's a great opportunity to work on your histories, your physical exam. And remember, these preceptors that have agreed to take you in the office are sort of the masters at the challenging parts of the physical exam in pediatrics, so use their expertise to help you hone your physical exam skills. Many preceptors will have you shadow them for the initial first few visits so you can get a flow of the practice, but after that you're off and running with a chance to see a lot of patients. Nearly all of our practices at this point are using an electronic medical record. They're not all the same, so please document in the EMR as the practice allows. This should be discussed specifically on the first day. If you happen to be in a practice where you're not going to be able to document directly in the EMR, take notes on paper, still complete the entire history and physical and staff with the attending, but just know that there are some logistics of documenting in the EMR that may make this challenging. Please, during this rotation, speak up for yourself. So there's a huge number of patients that come through a practice on any given day. An average pediatric practice will see upwards of 30 patients per provider each day. So when you're going in the room to see patients or looking at the initial schedule, identify those patients that you haven't had a chance to see before. Oftentimes, multiple patients will be being placed in rooms at the same time. So it's a really good chance to sort of pick and choose the patients that would be most valuable for you to see. We'd love you to see a selection of newborns, infants, up through the preschool and toddler years, and then a variety of school-age patients and teenagers as well, as they all provide unique challenges. Keep in mind that the practice is very busy, and so you may not have a chance to sit down and get all of your questions answered immediately after seeing a patient. Oftentimes, you need to have a place where you can take notes or jot down questions that may come up, so you can sit down and discuss these learning objectives at the end of the day. Our preceptors are very experienced in having students in the office, and so a lot of them have set aside specific time after patient care is done to sort of do a debrief on the day, go over any questions, and focus on learning objectives. In terms of the other details of the schedule while you're on outpatient, there are no night and weekend requirements. As I mentioned earlier, when you're in your outpatient 2 weeks, the schedule is only going to be Monday through Thursday. That actually leaves Friday morning as sort of an independent reading and learning time. This goes until 11 a.m. when the entire group is expected to come back together for chief rounds, which are located on the 8th floor in the education offices. This is sort of a nice opportunity to complete all of the other requirements we have for you during your pediatric rotation, such as CLIPS cases. It's a nice time to sort of sit down, make sure that you have had a chance to read about all of the patients that you've seen through the week, and sort of wrap up the entire week. Other questions that we get very frequently revolve around CAS evaluations. So as you guys know from the medical school, you're expected to log all patients that you see in whatever setting it may be into the CAS system. Please continue to do that throughout pediatrics. We want to see that you're seeing a variety of patients. But one of the more specific questions we get is, how should you actually be sending the CAS evaluations to your preceptor? Depending on the practice that you're in, we recommend that you're getting at least 2 CAS evaluations sent out for each week that you're in the clinic. If you're working with a single provider, please discuss with them on the first day how often they want to see CAS evals from you. Otherwise, in a group practice setting, we really recommend that you send 1 evaluation to each provider that you have a significant experience with. If you spend a half day or more in a clinic situation with 1 provider, please request a CAS evaluation for that. What I always recommend is just sit down with your preceptors on the first days that you're there, discuss the expectation, and determine a plan of when you're going to send the evaluations. CAS evaluations are helpful for us in terms of grading, but ultimately I care most that you're able to get feedback. So as long as you feel that at the debrief sessions at the end of the day or on a regular basis immediately after patient care, you're getting feedback to improve your performance, that's the most important thing. Don't ever worry if you're not getting a lot of responses or not getting a lot of timely responses from the CAS eval system. It can be a little bit burdensome from people who are seeing a lot of patients in the clinic. So I assure you that between myself, Dr. Dell, and Kelly, we will track down enough information to be able to provide you with some good feedback and complete grade at the end of the rotation. Going into outpatient clinic can be a little bit overwhelming. You spend a lot of time in the first years of medical school focusing on adult physical exams, adult histories, and what to expect. There's obviously some differences in pediatrics. So we've provided the website, which Kelly's emailed out to you, with a lot of resources that can help you be successful in outpatient practice. Some of the things that are really different in pediatrics, we focus on different areas. So one of the big things we focus on is growth and nutrition. Obviously, obesity has become a big problem across all boards, so you'll see issues like that with adults. But in pediatrics, we're specifically focusing on plotting on growth charts, nutrition and age-specific and age-appropriate nutrition. Many people aren't familiar with infant formulas, breastfeeding. Those topics come up pretty frequently. So we have some resources listed there that can be helpful for you. Another big area of focus, both for us as pediatricians and often for families as well, is sort of normal childhood development. You need to know what the normal or expected is for age, as well as the red flags of when you need to start worrying if children aren't meeting developmental milestones. I've posted on the website for you lots of resources, including some cheat sheets about development. These look at what's normal and appropriate divided by the age of the child, and they actually are sort of one quick sheet references that you can print out and keep with you when you're going in to see a patient. The more children you see at any given age, and you get to sort of see and interact with them and see what their development looks like, the easier this will be for you to remember. Immunizations are something we focus on across the entire lifespan, but obviously we're giving many more immunizations in the younger ages. This is something that I don't expect everyone to come in with the knowledge of the specific immunization charts. However, always have a reference with you so that you can look and see, is your patient up to date on immunizations? What are they due for? Are they following the typical vaccine schedule? I've posted a couple of recommendations on the website, but specifically cdc.org is a great resource, as well as immunize.org. And I'll be honest, as smartphones have gotten to be much more prevalent in society, there are some great apps that you can download right to your smartphone to reference and see if your patient's up to date on immunizations. We do lots of routine screening in pediatrics, and there are age-based guidelines for this. This includes things like monitoring for anemia, monitoring for elevated lead levels, autism screening. You'll see these used regularly throughout your practice, and go ahead and ask questions to your preceptor as issues come up with these things. Obviously, the other big piece of well child care is anticipatory guidance. So families often come to the pediatrician looking for guidance about what's normal, what's not normal, next steps to expect as their child gets older. And one of our jobs is to provide a lot of counseling for safety and guidance for these families. Take the lead from your preceptor. They've been doing this for a long time and are well versed at it. That's the basic summary of what to expect from the outpatient orientation. We hope that you have a great experience on your rotation. Our preceptors really enjoy working with students and have a great experience to share with you guys. Contact Kelly if there are any questions that arise when starting with the practices and throughout the rotation. She's a great resource, and we hope you enjoy your experience.